Morning, everyone. It's 8:30. We'll start the May meeting of the Douglas County Board of Health. For the record, over on the north wall here in white folder is a copy of the Open Meetings Act. Notice a public meeting was provided. And with that we'll go with item 1 and roll call.
Wade?
Here.
Festerson?
Here.
Rogers?
Here.
Wilkin?
Here.
Espinoza?
Item 2 is approval of the minutes of the April meeting. What's the will of the board? Is there a motion? Motion by Wade. Is there a second?
Second.
Second by Espinoza. Roll call.
Wilkin?
Abstain.
Okay, Wade?
Yes.
Rogers?
Yes.
Espinoza?
Yes.
And Festerson?
Yes. Item 4 is agenda items for the month of May. There are 11 items. If no one has anything that they want to pull separately, entertain a motion to approve items 1 through 11. Motion by Wade, second by Festerson. Roll call.
Festerson?
Yes.
Wilkin?
Yes.
Espinoza?
Yes.
Wade?
Yes.
And Rogers?
Yes. Item 5, Dr. Hughes and the Health Director's report and State of Public Health.
Good morning.
Morning.
We've got a small group today. All right. Well, welcome to May. This month, we are doing our annual State of Public Health presentation. So I am very much looking forward to having the opportunity to share that with you. So bear with me for just a moment as I get screens shared. Okay. So first off, I thought we would start with a quick reminder of what public health actually is. Public health is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. So that's kind of the baseline that we are working from as we talk about kind of what's happening in our community in terms of health, and then kind of our priorities and goals to improve that health here in our community. This is just a quick refresher of what it is that public health does. So we have 3 pillars that are assessment, policy development, and assurance, and then there are a whole lot of activities that fall under each of those legs of the stool, and all of that is really done from a lens of equity and ensuring that each person in our community has the same opportunity to be healthy. I wanted to, before I dive into the data, just give you a quick data note. We are still a little backlogged on data. And so many of the numbers that you're going to see here today are provisional. And basically what that means is that they just haven't been finalized yet. They are subject to change as those data are finalized. And the reason for that backlog, unfortunately, COVID is still affecting us, especially in this area. So as national and state organizations kind of shifted their focus to COVID activities, that allowed kind of a backlog of other data that needed to be finalized and worked with before it can be released. It is not as simple a process as people might imagine. It seems like you should just get a number and that's what the number is, right? But there are a number of validation processes and making sure the data are clean and things like this that have to happen before it's ever released. So it is fairly complicated. And then some of our data backlog exists because of workforce shortages and turnover here in the state. And, COVID kind of created an environment where people decided retirement was a great idea. And I think that has impacted every organization, but certainly especially like our vital statistics data. So I just want to go into this with you all being aware that what we're looking at isn't necessarily final data, but it is the best that we have right now. So let's just jump right in and look at the top causes of death for Douglas County in 2021. Again, provisional data. There really aren't any surprises in this top 10 list. So you'll see that cancer tops that list, followed by heart disease, COVID, accidents. When we say accidents, we mean all kinds of accidents. Stroke, chronic lung disease, Alzheimer's disease, diabetes, hypertension, and dementia. So I think if you looked at the top 10 causes of death in any community, you're probably going to see a fairly similar list to this. Moving on to our top 10 causes of morbidity in Douglas County. So we're looking at this in two different ways. So first of all, emergency room discharges. So we know this is these are the diagnoses that people are being discharged from emergency departments with. And then the hospital discharges is, we know that this is, these are the conditions people are discharged from the hospital with. So it's two different data sets that we can look at to kind of get a better idea of really what are the top causes of morbidity in our community. So should not be too much of a surprise that accidents of all kinds kind of tops that list. For emergency room discharges, you'll see mental disorder, COVID-19, childbirth complications, heart disease, maternal and other conditions, asthma, hypertension, diabetes, chronic lung disease, and suicide is following that at the 10th spot. And then our hospital discharges are fairly similar, although stroke actually moved up into the hospitalization data. So where that was not in the top 10 for ER discharges, which again isn't too surprising. Accidents, childbirth complications, mental disorders, heart disease, maternal, other conditions, cancer, COVID-19, stroke, diabetes, liver disease and cirrhosis, and chronic lung disease. So one thing I do want to note with this data is that these are not discrete, so you could have overlap. So if somebody is coming into the emergency department with some kind of an injury from an accident and it's severe enough that they then may be hospitalized, they could be counted in both of those columns. So just keep in mind that there is some crossover there. Did I just lose my share? Huh, okay. Give me just a moment here. I'm still showing a share on mine, so
It's not on the Zoom.
give me just a minute here to figure out what we're doing. Yeah, it looks like I froze up. Technology is sure great when it works, isn't it? Okay, I'm gonna do. Let's see if I can. My apologies. This may take me a minute. Oh boy, it sure is hating me today, isn't it? Well, there we go. Crisis averted. All right, thanks for bearing with me on that. Here's where we were. Okay, so emergency room discharges and hospital discharges, I think we kind of covered that as much as necessary. And that's just to give you a good idea of what's sending people, really what are the acute issues that are sending people to our hospital systems. We'll take a quick look at the outbreaks that have occurred in Douglas County over the past year. So these are 2022 outbreaks. Happily, this data is not provisional. This is
Dr.
up
Hughes,
to date.
is this showing up on the Zoom? Because I'm on the Zoom just looking for questions. and I'm not
Are we
seeing-
getting a note that it's not?
Well, I'm not seeing it
Okay,
on the Zoom.
give me a second. We can fix that too. Maybe. Except now I don't know where my presentation went because I minimized it. How about that? There we go.
Yep, it's back. Okay.
Sorry about that. Okay. So, outbreaks that we saw in Douglas County, this is really excluding those, excluding COVID. So we know that we still, in 2022, did have some outbreaks of COVID occurring in our community. So this is really looking at those other big ones that we look at. And I think this might have advanced one. Let me see. There we go. Okay, so in our long-term care and rehab facilities, and this is really looking at those places where outbreaks are more common because they're congregate settings. So we did have an influenza outbreak in a long-term care facility. We had several norovirus outbreaks. If you're not sure what norovirus is, it's basically that awful 24-hour stomach flu that goes around like wildfire. Very hard to stop the spread. So in a congregate setting, it definitely takes hold. And then we did have an RSV outbreak in a long-term care facility. We also had outbreaks in school settings, influenza, no surprise there. Luckily, no norovirus outbreaks this year in schools, and we did have RSV in our schools, which really is not a surprise if you recall kind of that trifecta of respiratory illnesses that we had circulating in 2022. In child care centers, we also saw a couple of norovirus outbreaks. Again, that is not anything surprising, and only one hand, foot, and mouth outbreak, which is actually, that's great. Hand, foot, and mouth is pretty common in daycare settings, and so we had one outbreak of that. And then in other settings, and really this is in the community at large, we had a couple of salmonella outbreaks. We did have the monkeypox outbreak. And then luckily we did not have any pertussis outbreaks in the community this year, that's fantastic news. So since we're on the subject of COVID, I did want to give you just a quick overview of what that looked like in 2022. And I'm going to do that by moving over to our dashboard. Please remember that this is a public dashboard, so anyone can access this data if they would like it. So what you'll see here is where we are at the top. It tells you where we are currently, but if you look down there at the bottom, you're going to get a much better idea of really what 2022 looked like. And 2022 starts about right there. So you can kind of, as we were going up, and if you remember, this was that fun Omicron, when Omicron hit and we had the big spike. So this is what we looked like in 2022. We had the big Omicron spike. We had a couple of much smaller waves that occurred over the summer and in the fall of 2022. And then happily this year, our transmission rates, or our case rates, I should say, are significantly lower. I will say we certainly still have transmission in the community, and I want to just be clear that yes, the public health emergency and global pandemic emergencies have ended, but that doesn't magically make the virus disappear. So we are still seeing transmission, and we are still keeping our eye on it. This dashboard looks just a little bit different. So if you recall, even a few weeks ago, there was a box in this lower right corner that told you what the community level was. That was a CDC statistic, and they discontinued that statistic with the end of the pandemic emergency for the United States. So since they ended it, we also took it off of ours. So that's why that is missing. We will also look at just really quickly so that you can get an idea of also deaths that have occurred. So this is total deaths over the entire pandemic. We don't have the graph up for that, but you can see for the whole pandemic, 1,334 deaths here in Douglas County. And again, some of that data is provisional because it's not all finalized yet for 2021 and 2022. So that you may see that change. And this just gives you a different way to look at the deaths that occurred due to COVID-19. So this is broken down in a variety of different ways, including age group, by sex, and then by race and ethnicity. So we are very happy that the COVID emergency has ended here in May, and we'll just have to see how things go moving forward. Right now, the plan is that testing and vaccine will be available as long as the supply that we had on hand when the pandemic emergency ended. Basically, we can use up that stock and continue to keep that free of charge after that. And the projection is that those will last likely till the end of 2023. And then after that, it's likely that some people could see a charge associated with getting a vaccination or a test, although the federal government is rolling out some programs to ensure those who are uninsured and underinsured are still able to get those vaccines. So there are plans that are being operationalized to ensure that there's equity in terms of who can get that vaccine going forward. I also wanted to explore with you another secondary data source, just to a couple of different sources to just help you be more familiar and maybe cast a bit of a wide net in terms of what's happening health-wise here in Douglas County. So this is the 2021 Douglas County Metro Community Health Assessment. So if you recall, this health assessment is done in concert with Sarpy, Cass County, and with Pottawatomie County over in Iowa, since we all make up the metro area. And that is also done with a number of health systems in the area, as well as some other organizations. And it's really spearheaded by the Wellbeing Partners. So we're very grateful to them for their work in this, especially because they did a lot of it as we were responding to COVID. So this was published last October. And the top concerns that were identified in this were mental health, nutrition, physical activity and weight, substance abuse, diabetes, sexual health, injury and violence, heart disease and stroke, tobacco use, infant health and family planning, potentially disabling conditions, which encompasses a whole lot of things, oral health, access to healthcare services, respiratory disease, and cancer. So I wanted to take you to the actual assessment so that you could see this. This also is public. You can go to the Wellbeing Partners website, and on their landing page, there are a couple of different links. One to the overall health assessment, and then there's also a pediatric health assessment that's published there. So that's what you're seeing right here. And this is, right now we're focusing, I'm just pulling this up to focus briefly on adults, to look at the different trends that you might see here in our community. So You'll see in here that there are several different variables, and you'll see the metro area compared to Nebraska and Iowa, the United States, and then compared to the Healthy People 2030 goals. And then there's a trend as well. So you'll see in here the metro area was trending worse, if you will, in terms of the number of people reporting worry, stress over rent or mortgage payments. If you think back to 2020, 2021 timeframe, that was a very difficult time for many people who were losing jobs because of the pandemic and other things happening. And so it's not surprising to see some of that happening. We also trended worse in people, the percentage of people reporting unhealthy and unsafe housing, and also the percent of people who went without electricity, water, and heat. So certainly when you're talking about kind of those underlying structures that give people the opportunity to be healthy or not, you see that we have a few areas here that are concerning. In terms of overall health, we're doing about like we have been for the past, I guess, couple iterations of the health assessment. So the percent reporting fair or poor overall health remained not fantastic, but not extremely changed either. You will see, though, that when you go into access to health care, the percent who went without coverage in the past year did trend negatively, if you will. Also, the percentage of people who found it difficult to get an appointment in the past year, and the percent that had transportation issues in terms of getting to the doctor. Again, keep in mind that this was 2020, 2021 timeframe, so unfortunately we have to view a lot of our data through the lens of COVID. We also had some, I would say, areas where we typically are not doing as well as our peers or as the nation. So in terms of people having had a routine checkup in the past year, we're still lagging there. And we also were trending down in those who, the percentage who have had 2 or more ER visits in the past year, and the percent of those with low health literacy. So a couple more areas, again, to view through the lens of COVID, if you will. Cancer came up as a concern for our residents. I will say that according to the numbers that we have, we certainly are not meeting Healthy People 2023 metrics if you look at that. So in terms of overall cancer, lung cancer, prostate, breast cancer, and colorectal cancer, we're still not down to where Healthy People 2030 would like us to be. We are, however, about average with Nebraska, Iowa, and the United States. We could do some work to improve the percentage of women getting their cervical cancer screenings. And again, I would just encourage you to look at that through that lens of we had some very difficult years for people to get access to care, but also this speaks to really the need to make sure women are getting those cervical cancer screenings early and as often as recommended. Diabetes was an area that we are not doing as well in as our peers and as the United States, especially in the percentage of people who have diabetes or high blood sugar, and that trend appears to be getting worse. Heart disease and stroke, the percent of people who experienced a stroke trended down. However, I should say it trended up, it got worse. So more people were experiencing stroke, but we are still kind of on par, if you will, at least with Nebraska. And then heart disease overall, we're doing a little better than Iowa and the United States. infant health and family planning, you can see that we are actually doing a little bit better in basically those reporting prenatal care in their first trimester. We're not doing as good as the United States. We're doing a little bit better in terms of Nebraska and Iowa. And then the infant death rate has unfortunately, that the trend there is something that's concerning. And I'll speak to this a little bit more in coming slides. Injury and violence, the percent of those over the age of 45 who fell in the past year, we unfortunately have had a significant number of falls compared to Nebraska, Iowa, and the United States, and it appears that area also is trending. Another one I wanted to point out in terms of violence is the percent of those who were victims of intimate partner violence. We unfortunately are trending in the wrong direction for that. Mental health is a big topic, so I'll spend a little bit more time here. The percentage of those diagnosed with depression here in the metro area is higher than pretty much all of our cohorts, including the United States, and appears to be getting worse. And again, that is no surprise. There were multiple things happening in 2020 that led to, I think, really that trend occurring and going down, us getting worse. We'll just say that. However, I know if you go back to previous community health assessments, it was still a big topic and something of concern. So what this tells me is that there were things that made it worse, and there are definitely things that we're going to need to do to help get our community to a better place in terms of mental health. Our suicide rate, unfortunately, did increase, and if you remember, that was the top 10. It was a top 10 reason for ER discharges was suicide. And then the percent of those who reported that they had someone to turn to all or most of the time, that was also trending downward. We also see that we are sitting a little bit higher in terms of the percent of those taking prescription medications or receiving mental health treatment in the area. And we are seeing a kind of negative trend in terms of those able to get mental health services in the metro area, and hopefully this is something that will improve. There were reasons people were not able to necessarily get those mental health services in 2020. Looking at nutrition, physical activity, and weight, you'll see Nebraskans maybe in metro area residents maybe aren't so great at eating their vegetables and their fruits, so that's something we could certainly improve on. We also are struggling with our leisure time physical activities. So the percent of people who are doing that was trending in the wrong direction. But happily, people are seeming to meet the physical activity guidelines. So it's interesting that at least in their leisure time, they're not getting it in, but likely they are getting it in other ways. Overweight and obesity continue to go up. This is not necessarily a surprise to anyone, but here's the proof. We are more overweight and more obese than our cohorts, and also more than the average for the United States. The percent of people who've had a dental visit in the past year also is low in comparison to our neighbors. However, we are doing actually pretty well for when you look at the Healthy People 2030 goal, which is 45%, and we're at 64.6%. So that's pretty good. Potentially disabling conditions, the ones that are most of concern, Alzheimer's disease. If you remember, that was also on that the mortality, top 10 mortality list, Alzheimer's disease. So that's, it's not necessarily surprising considering that the same things that impact Alzheimer's disease also impact other metrics that we're a little bit more used to looking at in terms of healthy living. So the same things that influence things like heart disease, cancer, obesity, those all also impact Alzheimer's. So it's not terribly surprising since we are struggling in those other areas to see that here as well. Looking at respiratory disease, asthma, and lung disease are areas where we struggle here in the metro area. And again, that shouldn't be a surprise given the other data we've looked at today. Sexual health continues to be a pretty big concern. So chlamydia and gonorrhea incidence rates are pretty high, even compared to the United States. I will talk a little bit more about that here in a couple minutes. Substance abuse, so those who, the percent that are excessive drinkers is high compared to the Nebraska average and Iowa. So that is something to keep in mind. And then unintentional drug-related deaths, we are higher than the state of Nebraska. Something to kind of keep in mind there is that we are the biggest city in Nebraska, and so there are, I will say, more opportunities because there are many more people in our area. So that could be something that kind of leans us heavy on that metric. And then to finish, tobacco use is something that is always a concern for us, especially given the number of people that have lung disease and COPD and emphysema. However, we are doing about like those in Nebraska, the rest of the state in terms of these metrics. We're actually performing a little bit better than the United States in some areas, so that's really good. However, we are continuing our efforts around tobacco cessation in public health. So that was a whole lot. But I think is really important to review. And then I'm going to do a very, very, very quick review of our Douglas County health data on county health rankings. And I don't know if you guys are terribly familiar with this particular tool. I think it's great in that it looks a little bit more at those social determinants of health and kind of the foundational things that are impacting health. It does have some actual health indicators as well in there, and then it ranks you. So you can rank yourself against your state, or you can rank yourself against other communities of a similar size.
Is this the University of Wisconsin?
I think that is who does this, but I can't remember for sure.
Yeah, it used to get shown to the board probably up until about 16 or 17. But I haven't seen this.
Okay. It's a great tool just to, when you're kind of taking in all of your different health indicators and you're looking at those things and trying to prioritize. It's just a good tool, I think, to know kind of where you stand. So Douglas County ranks 53rd out of 79 counties in Nebraska. In terms of health outcomes, we rank in the lower half of kind of the lower percentiles, and I'll show you the graphic here in a minute, which will help it make more sense. And then we do score slightly higher in terms of health factors, but those health outcomes are really dragging us down, I think. And then one thing that I will be pointing out to you is how some things can look okay on the surface. And then when you dig down deeper, you can find that there are actually inequities and issues that need to be addressed. But first, let's actually go to the website and not to my next slide. All right. Yeah. It's possible that they're not ranked, or they may be ranked together. Just the way that we're set up, in kind of a more regional format in some places. But I am not sure.
Before you move there, Doctor, so like to Marty's point, Yeah, I forgot how they do, but can you lay out your opinion on this? Because when I used to look at this, and I remember it being presented at a NACO piece a couple of times and
Mhm.
sitting in a couple of committee meetings, the suggestions were like we weren't size-wise really comparable to anybody in the state. So the question was meant like comparing it to other counties of similar size across the country. Okay,
Mhm.
so you okay? You
Yeah,
okay.
I totally understand that and would agree. A metro looks very different than a rural community. This is, and we can use this to look at other, basically us compared to similar ones. You have to do a little bit more manual work to do that. Something I'm certainly happy to explore if you want to. But this is where we're sitting right now. So this is what I mean by health outcomes kind of sitting a little lower, health factors sit a little higher. It does give a little bit of information about county demographics. This too is a public website, so countyhealthrankings.org. People are welcome to look at this. And this is kind of what it looks like. So it gives you this county snapshot and tells you what you look like compared to your state and the United States. So in terms of health outcomes, we've actually improved our trending in a good direction for premature deaths. However, we still have more premature deaths than the rest of the state of Nebraska. To your point, though, it is something to consider that a lot of premature deaths, you know, we have the potential to see a lot more because of the makeup of our community. Yeah.
Hold on, because let's ask the thing, because you're not, are you mic'd?
She's not. Well, she has a mic.
Um,
She can push the button.
come on, ask it. Yeah.
Ask.
Your green column, which shows like what the 3 counties, does these numbers compare to the metro area? Because this is just Douglas County.
This is just Douglas County, so this would not. This is a different data source, a different tool. So this is just another way to look at our data here, but this does not include Sarpy County or Pottawatomie County. So this is just Douglas County. Yeah. So what I wanted to show, so looking like at infant mortality. So this is an issue or a topic that has come up in our community quite a bit over the past year. And if you look at this data, it looks like we're sitting about average with Nebraska in the United States. However, if you expand this and dig down a little bit more deeply, and you disaggregate this by race and ethnicity, you'll see that the Black community has significantly higher, more than twice, the infant mortality rate than any other group. So it's a good tool, but it's very important to really dig deeper, especially where we know that locally there have been concerns and questions in our community. So I just wanted to show you that and make sure that you know that as we Douglas County Health Department are looking at this data, we are digging in and making sure that we're considering this from different angles. And then you'll see health factors, no surprise here, STIs, you see this red negative trend, and you can expand that and you can kind of see that we are in fact getting worse. In this measure, we are the dark brown line at the very top, sitting quite a bit higher than Nebraska in the United States. So we'll talk more about that in a minute. Clinical care, you'll see things seem to have gotten better. Again, this was 2021, so I think that there was a concerted effort to help people get into care as we kind of moved through the first part of the pandemic into kind of the later stages, and hopefully get people, as we opened back up, trying to get people in for care and things like that. And we also have a great healthcare system here in Douglas County. And then you'll see some social and economic factors that are looked at. and the physical environment. And speaking of air pollution, this morning's sunrise was very orange, if you didn't notice that. So I'm guessing our particulate matter measurements are a little bit high today. So that's how we are looking in terms of county health rankings. So again, this is not the end all be all. This is just another tool that we can use to look at how our community is doing compared to others. And if you are interested, perhaps when we have our admin committee meeting, we could dig in and look at this by some other communities that are more similar to ours, so that you can kind of get an idea how we are doing in comparison to them. However, this morning I still have a lot to cover, so I want to make sure we have time for that. So in 2022, we had a number of priorities that we wanted to focus on. So infant health was one of those. Lead was another, and then STIs. And I apologize that the D did not get changed to an I. It's only been in the last year that it officially went to I for infection and not D for disease. So, and all of that was really kind of centered around trauma and having a trauma-informed community, ensuring health equity, and then public health emergency preparedness. So to start with, we'll look at infant mortality because that's one that I pointed out in previous data. So our goal is to decrease rates of infant mortality in Douglas County to below 5 per 1,000 live births. And that is actually the Healthy People 2030 metric, so we're really trying to meet that. This, again, is not finalized data, so please keep in mind that those 2022 numbers are likely higher than what I'm reporting here. However, it does appear that our infant mortality rate did decrease between 2021 and 2022. However, I also want to remind you of what we saw on that previous slide, or on the County Health Rankings website when we looked at this a little bit more deeply. Black babies are dying at more than twice the rate that other babies are. And so we have a lot of work to do in terms of getting to equity there. And we want all rates to decrease, but there is certainly extra work, I think, that needs to happen. In 2022, we had some activities that helped move us toward that goal. So the Baby Blossom Collaborative was doing some behind-the-scenes work. Fetal infant mortality review team, as you know, we were without a femur nurse for a very long time. And so 2022 was really focused on getting that individual hired and trained up and really getting that femur process solidified and back in place. There are also other organizations within the community. This is definitely not a comprehensive list, but we have City Match, March of Dimes, Omaha Healthy Start, the Douglas County Breastfeeding Coalition, and I know that we have at least one FQHC that is working not just on Omaha Healthy Start, but on really targeting those the Black babies and moms who are struggling with infant mortality. This is just a little bit more data for you to look at in terms of these infant mortality rates, and I apologize for the bar. There we go. So infant mortality rates, this is actually a 10-year view, so you can kind of get a better idea of where we've been. We actually had several years there where we had a good decrease in our infant mortality rates going on, and then those went up, and then it looks like between 2021 and 2022 they decreased again, but again, that data is still provisional. We won't know for sure probably for another year with that. And this again is breaking that out by race and ethnicity. So looking at that same data, you'll see Douglas County, which is all of these lines, but broken out by those races. You'll see that some are decreasing. So white infants, that's on the decrease. However, if you look at those Black infants, that is where we have seen really a very large increase between 2019 and now. Moving on to lead poisoning prevention. So this has been a huge push in our community. So our 2022 goals were to increase blood lead screening in Douglas County, to conduct risk assessments and inspections in those homes with children under 7 years of age, and to provide interior lead dust home visits to properties that have had soil remediation. So all of these are things that we have been working on for years and years due to really the Lead Superfund site that's here in Douglas County, and really targeting those families to ensure that lead poisoning isn't occurring. But we would do lead assessments for any child who tested high for blood lead levels, regardless of where they live. So the activities that we did in 2022, providing lead education to those cases that are popping up, attending and having outreach events in the community with clinics and residents to increase screening rates, and then making lead education materials accessible to the community through a variety of avenues. We did also conduct risk assessments for those homes with kiddos under 7, and then we also continue to do those interior lead dust visits. So the results of doing all of those activities is that we significantly increased the number of children screened. So you'll see 2022, 17,000, which was more than the 16.9 from the previous year. And again, we were not going into homes quite as much in 2021 due to the pandemic. So this really points to the fact that our lead team really wasted no time in getting back out there as soon as we were able to. We did 253 lead risk assessments in 2022 versus 111 the previous year. We did 108 interior dust home visits in 2022 versus just 9 in the previous year. And then we reached 190,702 people with education through outreach in 2022 versus just 72,000 in the previous year. So big kudos to our lead team, who, again, wasted no time getting back out there and ensuring that these families are being given the services that they need. This just gives you a different visual over time of the number of tests that were done for children to test for lead. So you'll see, even going back to 1999, we ramped up for years and years, and then COVID hit. And we are getting back out there, and hopefully we'll be back up high for testing soon. And then this just gives you a race and ethnicity breakdown of cases of high lead levels in our community. There isn't a huge change between 2021 and 2022. You'll see that there was a bigger increase in the Asian population. The others stayed fairly static. And moving on to STIs. In 2022, our goals coming out of the pandemic were really to reestablish those pre-pandemic STI outreach activities and clinic activities. So a lot of our STI staff were, yes, still doing some minimal STI work, but really this is clinic staff and outreach staff, and a lot of them were retasked to COVID. So this is kind of moving people back over into the STI work. We also wanted to increase community awareness and use of public health STI services. And ultimately, we want to reduce the rates of chlamydia, gonorrhea, syphilis, and HIV in Douglas County. The activities that we undertook included increasing the STI clinic services. As we demobilized some of our pandemic activities, we, as quickly as possible, moved them back over to the STI side of the house so that those services could ramp back up. We increased community awareness of our STI outreach testing and used a variety of different social media audience-specific advertising to do that. And then really overall to reduce those rates, we did things such as establishing that STI at-home testing program. We also participated in a study for self-collected extragenital body site samples and validated that. So basically what that means is hopefully we'll be able to increase the sites at which people can, body sites at which people can test for an STI at home. So it's using those at-home testing processes. And then develop STI clinic program to assess and refer patients confronting different social determinants of health, which we know can increase the risk for STI. So, and that is ongoing work. So the results of all of that work for 2022, we more than doubled our clinic visits, which is fantastic. However, the number of hours that we are able to operate decreased. So pre-pandemic, we were open 60 hours a week for STI services. Unfortunately, we've had to decrease that to 48 hours per week. The reason for that is we had a fairly significant funding cut. And so unfortunately, that meant that we could not offer the same extended hours that we were able to previously. I will say that Dr. Casanave has done a fantastic job of trying to make sure that we are still offering some extended hours for people. It is just not as many as we were able to do previously. So I just want to commend her for ensuring that with what we have, we are still able to reach to at least offer some of those extended hours for people who may not be able to come to the clinic during traditional hours. We also almost doubled our outreach for 2022. We also distributed many more condoms than we did in 2021, so about 60,000 more than we had the previous year. And as of now, we have distributed 78 STI at-home testing kits. And I know we have had probably more than double that in terms of people calling in and requesting those kits. And the reason for that is, first of all, some people who may be calling in and requesting a kit, once they've talked to an STI educator, may not actually be eligible for that test. They may, if they're very symptomatic, they would need to come in and be seen. So we wouldn't be sending them a kit, even though they've contacted us. We also have some people who are lost to follow-up, so perhaps they have asked for that, and then when we have reached out to get the information that we need to send them the correct kit, we're not able to get a hold of them. So there are a couple of different things that could influence the fact that we haven't given out as many as the contacts we've had. But we have had, I think, over 200 people who have contacted us for these at-home tests so far. A couple of charts just illustrating STIs here in our community. So as you can see, chlamydia is on the increase. Gonorrhea, for a change, appears to be decreasing. And then syphilis is increasing. And I know that that little green line down there does not look like a significant increase, but given the poor outcomes that one can have from syphilis, this is really, really concerning to us, and it's something that we definitely want to be focusing on going forward. We also want to break out a little bit our rates, or this is just looking at chlamydia, but you would see similar trends if we looked at each one individually. So by race and ethnicity, I think that we have some disparities in access and how people are able to access STI testing. And so this is another one of those areas that we really need to break down the data and see where are people struggling, where are the gaps in what we're doing in our community to make sure people can get the care that they need. All right, this is just showing you kind of what clinic visits did over time. So we were doing a really great job of increasing our services, and then COVID hit, which I feel like is the theme. This is the syphilis rate. So this is where we just really have a lot of concerns. So you'll see Douglas County is that yellow orangish line, and we have been going up over time, but you've seen a more steep climb in those rates since 2020. Syphilis can become a major issue if it's not treated very early in its process. So one of the big concerns that we have, especially in women, is that this can be transmitted to an infant while in utero. So you have babies that are being born with congenital syphilis, and we have in fact had a couple of cases of that recently. And congenital syphilis can be fatal. It can also cause long-term birth defects. So this is something that we certainly are concerned about. And this is, I mean, you can see in the United States, which is the yellow line now, Douglas County is the blue line, I'm sorry. The overall, our rates have been going up across the nation. But here in Douglas County, this is something that we feel that we really do need to give a special attention to. So that was 2022, and now it's 2023. So let's talk about where we are going forward, looking at all of this data that I've just kind of fire hosed you with. So I've changed our model just a little bit. I want to make it really clear that as we are working on our priorities, that we are really surrounding our work with that health equity lens, which is why I've been breaking down that data as we've gone through to look at, especially by race and ethnicity, and then ensuring, especially coming out of COVID, that our approach to our services is trauma informed. Because mental health continues to be a major issue. So our first priority is mental health. And this is because, first of all, it is something that is of concern, and I think we all know that. It also has risen to the top as the health priority for the metro area for several iterations of the community health assessment and community health improvement plans over the past few years. So it makes sense that we would also prioritize it here for Douglas County. Our goals are to improve the mental health of Douglas County residents by connecting people to increase social supports. We also want to improve the mental health of Douglas County residents by reducing stigma associated with mental health conditions and the stigma associated with seeking treatment. We also want to improve Douglas County residents' connections to mental health and preventive resources, continue to work to understand trauma in the Douglas County population. So we know people have high ACEs scores out there, but we don't necessarily always know why and what's driving that. And so that's kind of the next step in the process, is really gaining a better understanding of where those traumas have come from. And then ensure all Douglas County staff or Douglas County Health Department staff are trauma informed and can administer mental health first aid. The activities that we will be undertaking to achieve all of this includes identifying evidence-based strategies to increase the awareness and importance of social supports and educating the public on how do you do that? How do you get improved social supports? We want to partner with area organizations to really work together to make sure that social supports are available for people, and implement targeted programming for youth to destigmatize the use of therapy and other mental health services. I'm very excited about a project in our health promotion program called Project New Lens. And this really seeks to enroll youth who could benefit from mental health services, but perhaps don't want to because of the way that traditional therapy is kind of portrayed. And so we want to expose them to other treatment and therapy modalities that are out there that might be more attractive. So they will get to, in a group setting, experience what it would be like to have equine therapy or ecotherapy, so using horses in therapy, which is actually an evidence-based method of therapy, some types of therapy, and ecotherapy, nature, being outside, and how you can incorporate that into your mental health, your mental health support. So we will be partnering with some providers to basically walk kids through what it's like to get these types of services so that they can see that, hey, this is actually pretty cool. You know, it's not all just sitting in an office and talking about issues. So at some point we will have someone come and present on Project New Lens when it's ready for prime time, and so you'll get all of the information on how that program is set up. We will also continue to partner with our community so that we know what resources are out there and how we can do a better job of referring people into those. Also partnering to conduct an environmental scan to better understand the roots of trauma in our community. So I've already given our last community health assessment data set to our health equity epidemiologist to start breaking down the data and really looking at those, basically those ACEs scores. So we actually do the ACEs questions in the survey that PRC does for the community health assessment. We don't do it every iteration. It sounds like maybe every other is what we're looking at. So coming up, we'll be doing it again. But I want us to have a better idea of how people are scoring on those and what is the most common ACEs variable that floats up to the top. And just breaking the data down in other ways too, so that we can have a better understanding of why the traumas have occurred. And then completing trauma-informed care and mental health first aid training for our Douglas County Health Department employees, which is ongoing. Moving on to STI. Yes, we are prioritizing STI again. I think this might stay on our list for a little while. Our 2023 goals are to reduce rates of STIs in our community, continue to increase the number of patients served by STI outreach and clinic activities, which will be a challenge due to those cuts in resources, but we still are committed to ensuring that we can get patients in. Increasing community awareness and use of our STI services, and then decreasing our syphilis rates, especially in women. We're planning to achieve this by identifying funding sources so that we can ensure we can continue offering testing, treatment, and outreach services, especially to those populations needing it. And Dr. Casanave doesn't know this yet because it just happened yesterday, but had very, very good brainstorming session with the director from SARPI-CAS yesterday around how we might be able to start approaching STIs from a regional perspective as well. So I'm very excited by that, and I'm hoping that that will be a way to kind of synergize our work, especially in light of the decreased funding that we have this coming year. We finalized the validation study for those self-collected body site samples to enhance the availability for different testing, and that's really for those at-home tests again. We're also implementing an electronic health record system so that we can redefine our work and do a better, more efficient job of moving patients through and give our staff a better way to work. If we can increase efficiency with our staff, that means possibly the ability to see more patients. So that's a good thing. We did make the choice on that system here just maybe a week or two ago, and so we are full steam ahead on that project. Improving community awareness of STI clinic and outreach, kind of some of those same things that we've done in the past in terms of getting the word out there and doing outreach to our community and using lots of different ways to do that. And then we want to educate our community on the impacts of syphilis, especially as it relates to those perinatal cases. In terms of infant mortality, I'm prioritizing this again, absolutely. For 2023, our goals are to decrease the rates of infant mortality in Douglas County. We also want to decrease the rates of Black infant mortality in Douglas County. And then we want to look at what are the root causes of disparities in fetal and infant deaths compared to the rest. And the activities that we are undertaking to achieve this, we have rebooted Baby Blossom. So this is that perinatal quality collaborative that Douglas County Health Department has run over the years. And we're very happy to say we just had kind of our relaunch of Baby Blossoms about a month ago. And so our hope is to get our community partners engaged, build and improve those partnerships so that we can share resources and ideas to address infant mortality here in Douglas County. Exploring other evidence-based approaches that might help us to decrease those rates. And of course, we're going to continue to provide WIC services, especially those breastfeeding services that they can provide. We also are going to utilize our health equity team to explore those disparities in infant deaths and the possible root causes that have led to those deaths. And FEMR, as you know, had a long pause, and January was our relaunch for that. So each month the FEMR team comes together to do case reviews, and that work is ongoing, and I'm really excited to see how that work informs kind of what comes out of Baby Blossoms in terms of recommendations for our community addressing this issue. And then our last goal for this coming year is really around infrastructure. You know, COVID really shook things up for us, and I think really highlighted the fact that having a strong public health infrastructure is vital, not only just on the day-to-day stuff, but when something big happens. It is so vital for us to have a system that is ready to roll as soon as something comes up and not having a lag in our response. So our goals in 2023 are to strengthen the delivery of those 10 essential public health services. We also want to build and strengthen our public health workforce. We want to improve our data capacity so that we can be agile in our response to health outcomes. We also want to increase transparency and communications with partners and the public. That is something that we talk about almost on a daily basis, is how do we communicate better with the people that we serve. And then improve the ability for all of Douglas County Health Department to respond in a public health emergency. So this is really looking at that preparedness program that we have and ensuring that it's not just a program that kind of sits off in the corner and does its thing to create plans, but that the department on the whole doesn't necessarily know how to implement. We will be really spreading the joy, if you will, so that all of Douglas County Health Department employees have some kind of an interaction with the preparedness program and have an understanding of, hey, if something happened and we were to activate any number of different scenarios, what could my role look like? And so hopefully that helps us save time when something does come up so that we're not in the thick of it trying to figure out where to put people. Our activities include successfully applying for accreditation through FAB, and I'm very happy to let you know that we are on track for that to happen. We are also working on operationalizing that CDC infrastructure grant that we got, and that grant is really going to inform a whole lot of this work. We will be hiring a workforce development manager through that infrastructure grant, and that person is really going to be responsible for things like developing a robust orientation platform and program for incoming employees and ensuring that training for all employees is accessible, that people can get what they need for their professional development. And that person also will be assessing gaps to improve orientation and training. We're also looking at our data systems and our current data needs through a data work group, and we are going to be really looking at what we need to be agile and to make sure that we can be transparent with our community, and then working to build whatever it is that we need to build to make that happen, and to ensure that as we are collecting data and displaying data, that we are always doing so through an equity lens that is unbiased and complete. And then we will be ensuring that we are doing robust evaluation across our programs. One of our hopes is to build out a data dashboard that is even bigger than what we have out there right now. Expanding communication staff so that we can best utilize things like social media. And again, with the preparedness, just really ensuring that all staff understand what preparedness looks like for them. And also, we are going to be making an effort to reassess our our pod plan. So a pod is a point of dispensing. So you can use those to get lots of people through for medications or vaccines or whatever you need. So when you saw all of those little pop-up clinics that we did, if you remember, like the drive-through clinics, the clinic we had out at CHI, those are all versions of a pod. And we are actually going to hopefully be expanding that to begin building a CRC plan. I would love to talk to you ad nauseum about that one because it's really exciting, but I will spare you and just keep it short and tell you the intent there. If we had a very large, let's say we had some kind of widespread chemical exposure or a radiation event, we would need a place for those who are not acutely ill to go for things like decontamination or to get medications and things like that. This was a question that came up through an exercise I guess it was probably about 6 weeks ago now. And when we asked the question, well, who stands up the CRC? And it was a radiological tabletop exercise. And we said, well, who sets up the CRC? And it was kind of silent in the room. And if you look at best practices, this actually is a public health activity to set up a CRC. So I said, well, that would be us. We would be the ones who would need to be setting up the CRC. I think that made the community pretty happy to hear that somebody was willing to make those plans. And so we brought that back, and our ERCs are already working on looking at that. And it's basically, think of a point of dispensing. So, you kind of have a central location people can come to get medications or whatever. A CRC is that on a really big scale with some bigger activities. So we'll be building the CRC kind of based on those pod plans. So I'm very excited about that. And I think it's going to be, a very helpful thing to have if anything should happen. And I think if the last few years have taught us anything, it's that anything could happen. That is the sum of my presentation in terms of where we are here in Douglas County and where our priorities lie for the next year. I did want to take a minute, though, to talk about that data modernization piece just a little bit because it directly influences this particular presentation to you each year. We have assembled a work group and it starts next month, to really focus on improving the future data collection, analysis, and dissemination of the information that comes out of that. We have so much data that just is not in a great consumable format, and we really need to do a very intentional look at how we're doing that. Our goal is really to provide our community and you as our board with a dynamic data dashboard. I talked about that just a little bit. And that will allow citizens and stakeholders to access timely information on key health indicators so that they can make choices for their lives that are healthy. And then my goal really for this particular presentation is to follow a goal-setting cadence that's more in line with our community health assessment and CHIP process. And then really looking at those indicators and outcomes as more long-term goals so that they're not changing from year to year. Because this is public health. We play the long game, and we know that sometimes we got to work at things for more than just a year or two to get things accomplished. So I think future state of public health will look similar, but have a little bit of a different focus on long-term goals. I also want to thank all of the people who worked really hard to put this presentation together. It was not just me. I have to just tell you how grateful I am to have such great people who are ready and willing at the drop of a hat to get things going and make sure that we have what we need for presentations like this. So our vital statistics section was integral to this presentation, as was our epidemiology section, our lead program, our STI program, our health promotion people, my management team, who I have to give props to my management team because they have gotten so great at just collaborating and working together and being comfortable sharing sometimes criticisms that make things better, but sometimes are hard to hear. So I'm very grateful to them for all of their openness in these types of processes. And then all of the other staff that gave input to make this presentation. And it's pretty because Connie Blackburn works for us, and she is our graphic designer in our health promotion program, and she is the one who actually designed and made sure that these slides actually were legible and looked nice. So thank you, Connie, for that. And with that, I will go ahead and end. Thank you.
So just one question on the stats. I mean, great, a lot of numbers obviously early on, and certainly makes sense that COVID impacted a lot of those stats. I'd be curious if there was any kind of national stat, like certainly I know like with when you talked about mental health or weight, diabetes, inactivity, things that COVID lockdowns impacted that, but I guess you would think it wouldn't impact every community exactly the same, that certain areas would have been hit harder than others. And it seemed like on some of those stats that Douglas County took a bigger hit than the national average did, even though you see the national average go down. But it'd be, I don't know if you ever see or come across any stats of like where parts of the nation were impacted and stuff, but it was interesting or curious to see why were we impacted more than the average U.S. during those things. So I don't know if you ever come across that.
That is such a good point. Thank you for pointing that out. And I have not dug into national data related to that. I can say what COVID did was really highlighted the gaps that were likely already there. So we probably saw smaller gaps before COVID. I mean, you may have seen, okay, we're not performing quite as well here or there, but maybe that was a small gap. COVID kind of blew things up. So it really highlighted where the cracks are. And I think that would probably vary from community to community depending on, the population makeup, what resources they have available, things like that. So I think it's a great question and certainly would be interesting to take a deeper dive into.
Yep.
Go ahead.
So thank you, Lindsay, for that presentation. And it was a lot of information and a lot of statistics that I think I mostly digested. And I appreciated the outline of the priorities this year and where the health department is going and addressing those for the community. I'm curious how you'd answer this question for those that might be listening in from the general public or someone you might encounter in your day-to-day activities out in the community. If they asked you what is the state of public health in Douglas County, how would you summarize that in a very short paragraph or two?
I give us a C+ to a B- in public health. Based on the data that we're seeing here. I'm probably grading that a little bit on a curve, to be honest. And part of that is the eternal optimist in me knows that, okay, we've hit some bumps. We had this COVID bump, right? But we have this amazing community that I know is going to come together and we're going to see improvements in these things. So even though on the surface, we have some areas that definitely need some extra attention, I think we can get there. So the state of the public health is, we are doing great in some ways, and we definitely we always will have work to do, but if I had to give us a grade, it would be a C+, B-.
Just a quick comment, Doctor. First of all, thank you to your team and all the great work that they did through our COVID. I wanted to highlight and just to have you keep in mind when we move forward on this work that's much needed, to really reach out to your community partners. They were really willing to work with us through COVID, and they're still willing to really work with the health department to provide those services and bring those services to the communities that most need it. So really think about reaching out to those community partners. They're there to work with us and to serve our community as well.
Yeah, thank you for that. I agree wholeheartedly with you. We have some of the most amazing community partners, and one of the best things about being where we are in terms of COVID is that now we can get out and actually be face to face with our partners and really have much richer collaborations than we were able to before. But goodness, we could not have done what we've done without the partners that we have. None of this work happens just us in a vacuum. It's so many people. So thank you for that, and we will definitely make sure that we are collaborating and partnering with our community.
Seeing none here. And seeing no questions in the chat. Thank you.
Great, thank you so much.
All right. With that, we have no presentations. And does anyone have any questions from the reports? If nobody has, I have one. That's to you, Dr. Hughes, or Justin, however you want to handle it. I'm just curious why epi spending budget is so low.
Say that again?
Epidemiology's, the spending budget is so low.
Yeah. Mr. Justin Frederick, for you.
First of all, you're right.
Okay.
It is. A lot of our budget for our infectious disease epi group comes from public health preparedness funds.
Okay.
There are county dollars that offset that, but this has been an ongoing discussion that I've been having with the director. I know, Chris, you and I have talked with the Region 7 director as well. Our community is very different than a lot of communities in the sense that we have a biocontainment unit, we have the national quarantine unit. So I have continued those discussions with UNMC and with CDC partners to try to increase funding for that particular group.
Well, let me frame it, Justin. I'm saying, like, if I'm reading it right, it says you just spent 18% of it so far. That's what I'm asking.
Oh, well, you're probably seeing that because a lot of our group was under ARPA funds for COVID response. So that's why we'd be underspent in that group.
So are you gonna have money left over?
I'm sorry, what?
Are you gonna have, how much money are you gonna have left?
How much money
if
am I
I'm
gonna
reading
have
it right
left?
from the report, it's just saying if I'm reading it wrong, it's when I'm referring to an underspent is I'm reading it as you spent just 18% of your budget this year with like a month remaining. Am I reading it wrong?
I would have to
In
go
the
back
report?
and look, but that might be
Okay.
correct again because of ARPA funds and other funding that we
Okay.
received due to the pandemic.
So
But-
yeah, I don't mean to imply like,
But
I mean to imply because of, that's what I was trying to figure out. If it's because of ARPA and the other funding, will you have money left over? How much? Are you all encumbering it? What are you doing?
yes, so that money does roll up into
Okay.
the department's budget where we are able to take that and then complete some projects and tasks and upgrades that we would like to do.
Okay.
But moving forward, again, we're looking at how do I sustain and build infrastructure within the EPI group with our partners, CDC, and local partners, UNMC.
So just while you're there, explain to me how you interpreted what I was saying. You mean like
I thought you were saying
more
we were
to
under.
deal with UNMC and stuff like that?
No, I thought you were saying that for the work that group does, we have a small budget.
Oh, I'm
is
sure.
what I thought
it
you were
could-
saying.
Yeah, I'm sure all of it could be
Yeah.
more, no doubt.
Which is
Um,
true, just
okay.
so you know.
But I mean, I'm just curious. What are you saying in regards to? You're explaining from the point we were in meetings of leveraging other stuff that's out there because of your need. That's what you
Correct.
refer. Okay, I got it. Okay.
Yes.
So just so everybody's up to speed, there was a meeting we had with the regional HHS director, and the topic that was brought up in the meeting is you're going to have a $3 billion XL facility that's going to be needed to treat that. They're going to have to come through the department somehow. And the conversation that was actually, which goes back to February of 20 before COVID hit, when that was announced that there was a couple of visits up in Capitol Hill, and we were saying that, there's easily in a $150 billion request could be 2-3 million or so dedicated to the local departments to keep them up to speed to be able to reply when that hits. So just for context, that's what Justin's talking about. Okay, I got it.
Okay.
Okay,
Thank you.
thanks. All right, with that said, with no more questions, our next meeting is the 21st, and the administrative committee meeting is set for the first Friday in February. I don't know of need for executive session, so is there a motion to adjourn? Second. Second by John Wade. Blank. Roll call. Yes. See you all. Thank you. Thank you.